we didn't sign up to die at our jobs. It's not the same as going to an actual war. This is healthcare. We were already aware that we didn't have a lot of PPE, but it felt like our hospitals and just the whole country didn't think that we would get hit the way that they did, that we wouldn't have that amount of cases. But it was frustrating because you go into healthcare, thinking like you want to take care of people and you want to care for patients, and we didn't sign up to die at our job.
You're spread so thin. We don't have a state law where it's mandated to have staffing ratios. And now we're seeing that play out very clearly with the lack of staffing, especially the lack of nurses, because you don't have anyone at the best. Our New York State Department of Health just put out that we were probably running out of personal protective equipment. JCAHO, Joint Commission, they accredit hospitals, have put out there, come in with your own supply. We need the stuff that is seen in Italy and in China. You see, they have their hazmat suits.
We don't have the equipment we need to take care and protect ourselves at these hospitals. I have friends that are having trouble sleeping, waking up in the middle of the night with nightmares. They're not, their eating habits are different. We're not taking care of ourselves the same way as we were before. I think the entire environment and climate would be a lot different if nurses had N95s to wear or had, the appropriate equipment that we need to take care of ourselves.
Colleagues who've gotten sick and who are in intensive care. You think you're invincible almost when you're in healthcare, and then you see your colleagues get sick.
The entire idea and concept of Western medicine as we know it has obviously failed us, right? So the entire idea that this is an industry and a for-profit organization and these institutions are made to make money has really deterred us and gotten us to this point now where we don't even have supplies to take care of its workers. And hospitals forget that without workers, there would be no hospital.
2020 was designated the year of the nurse by WHO, by the World Health Organization. We thought that it was going to be like a year where, nurses were celebrated for, everything that we've done in the past. But now it's really come down to nurses are like at the front lines. They're sleep deprived, like physically exhausted, very anxious.
It's like mentally draining, and then thinking about like the next step in the next couple of weeks of what's happening after this, when the peak really hits. Like, none of us are mentally prepared for what could happen and what's going on in New York.
I know after this is over, there's going to be a lot of people who's going to need services. The post-traumatic stress of dealing with seeing dead bodies all the time. People are dying, morgues are filled. They have trucks to put bodies in. This is traumatic. This is traumatic, not just for us as staff members, but also the community. People can't even be with their loved ones in those last moments, and it's hell.
I have my friends who are discussing like end of life measures for them with their family and telling them like what they would want. The other day I was talking to my fiance, and I was just crying with him because I was like, I don't want to die. I won't shame anyone that is quitting their jobs in nursing or in healthcare because they don't want to die or they don't want to pass it on to their child who has cancer or their family member who has cancer or is immunocompromised. And we're not martyrs.
I'm a mother to a 5-year-old, and my husband is immunocompromised, so I'm always worried that I am bringing something back to them. It's hard to take off that hat from work. I feel like I'm being a poor mom because I can't really be there mentally for him because I'm just thinking about the bigger picture of everyone around me. There are so many of us out there who are afraid and scared, and all we have left of our dignity is to just show up for work and do our best.
The biggest thing that I want people to focus on after this is over is our mental health, because a lot of us are going to be going through it. So just look after your people in healthcare after this is over, if they're still here.